Well, we have two things, more than two things on this. Let me start with the sensitive skin. Sensitive skin is something that is very commonly said, but when it comes to the medical part, you have to be more specific. Is the skin reactive? And it means it's reactive, it reacts to a certain substance. That's what we call a reactive skin. It reacts to retinol, or react to perfume, or there's some allergies involved with that. That's a type of reaction you can have. Or if you are sensitive to the sun, because you have a very fair skin and the sunlight just gets you burn and red and etc. Or if you have some pigmentation, and then we got the pigmentation where melasma is there, and the moment you get exposed to sun, it gets more evident. Or depending on the cosmetics that you are using, or if the skin is dry and scaled. So sensitive skin can be a huge amount of situations. It'd be a very big thing. We need to narrow down to understand exactly what's the problem is. Regarding PRP, I do PRP, although I'm not a very big believer on PRP, because growth factors, which is the base of PRP, they do work, but they work in a sequence. It's what we have when if you have a cut, those growth factors are released in a very defined sequence to help repairing the tissues and stopping the bleeding. And also they are promoting inflammation at the beginning. So I don't really understand why we are using PRP, and there's very conflicted arguments and evidence about how it works. Some physicians are really happy and a very good experience with it. Other ones, I don't see anything. So it's a mixture of both. Ideally, I think we should use the growth factors that are needed for specific areas. And you don't need all the growth factors to improve the skin quality or even the pigmentation. Other problem with PRP is there's something you need to repeat very, very, very often, otherwise it doesn't work. Okay, so we have to keep on doing it. And I tried, especially for areas that are difficult to treat, like the dark circles, for instance, and the results are very limited on that. In terms of revitalization and improving the skin tone, I think the skin boosters and the biorevitalization with hyaluronic acid, vitamins, and also with a good skin care, it's much more superior to PRP. But sometimes I do PRP and patients are really seeing the results of it, they insist on it, and I'll do that. But again, it's not one of my favorite treatments, I have to be honest with you.